actually the #1 treatment. A short burst of steroids, like 3 days, knock it out. But anyway, so then there's a lot of so foods and beverages. Then I only put them kind of grouped together because they are kind of grouped together, but also because I was running out of room. Biofeedback, acupuncture, massage, chiropractic, meditation, aromas, music therapy are all more kind of complementary, alternative, behavioral, lifestyle things that can help to avoid a headache. Then you have the preventatives, and you'll see that a lot of them actually can also cross over, right? So there are specific types of medications that we can use to treat migraines. There are injections that like Botox is used as a migraine preventative treatment. Natural supplements, avoiding triggers, doing your headache calendars, weight loss, good sleep hygiene is not on here, but it's supposed to be diet, nutrition, exercise, and all of these things. Okay, next. So the other way to think about migraine, the other way that you could kind of think about all of these same kinds of treatments is looking at it this way. There are traditional medical treatments, there are kind of more natural remedies, behavioral, and stress management. A lot of those ones that I talked about are, right now anyway, they're thought to be stress-reducing techniques. They help with stress management. They make you feel better in general. When you feel better in general and you cope with your stress better, you have fewer migraines. That not only can it help avoid an attack, there's some really, really, really great stuff just out this month about really good neurochemical and imaging studies looking at the brains of people who are under a lot of stress and how the brain chemistry changes. And that brain chemistry, we know, can impact migraine. And so if you can change that brain chemistry by meditation or acupuncture or biofeedback or whatever it is that you choose to help you cope with your stress, it's actually making changes in your brain that are going to help your migraines. All of these are really, really important. They're not very easy. Sleep hygiene is one of the hardest ones. Going to sleep at the same time every night, waking up at the same time every morning. Exercise, well, I know about that one. It's really hard to do. And even the diet, nutrition, it's very, very difficult, to do some of these things. And I do all of these. I also prescribe these. Well, you don't need a prescription for them, but I do them. I counsel people on these, and I like my patients to do these, but I don't do them myself. The music therapy is very interesting. Really, in the last few years, some interesting data coming out about using migraine for pain relief of all different kinds of pain disorders, but also specifically in migraine. We also find that things like music and biofeedback work really, really well in kids. So a lot of times in kids, you don't want to give them a lot of medications.
Do you
these therapies work very well in
music therapy not while you're having a migraine?
Yes.
Mm-hmm. How can you hear music when you have a severe? I need pure silence.
You may not be able to. It may not be for everybody.
Not for me. Okay.
The same thing goes for massage. I was talking to someone about using massage. Many migraineurs can't stand being touched. During a migraine, don't touch me.
No light.
Yeah, don't squeeze my neck. Are you crazy?
No,
yeah, nothing. But some people do get some relief acutely with an acute attack. And I think overall it tends to be more helpful as a preventative to help with stress reduction.
You know, when I play with migraine episode, I hear my cat walking.
That's bad. So your brain is very hypersensitive when it's having a migraine.
I hear my cat.
And you smell everything.
Next one. And what time
terrible.
Oh, okay. So we have to.
Take as long as you need.
So, what your doctor can do for you, help to identify patterns and triggers, can help you devise a treatment plan, can prescribe abortive medications, preventative medications, and do things like injections.
Is Botox the last result? I mean, how often would you recommend Botox?
I recommend it pretty frequently. The problem with it, I would love to recommend it more. The problem with it is that it's very expensive and a lot of the insurance companies don't cover it. So
they put it
can
here?
be problematic. Yeah.
Where on your head face does it go anyway?
Here, and it depends on where you're having the headaches, the side of the head, back of the head.
But it's
I still have
subdermal, I mean,
What was that?
what kind of injection is it? Subdermal or it's
Yeah,
subcutaneous?
subcutaneous.
And
They say IM, but I mean, those muscle fiber, nobody's really
No.
injecting IM. They're tiny, thin muscle
Could there
fibers.
be like other issues aside from, I mean, treating maybe the symptom of the headache or the migraine with the Botox, but Botox is a toxin, right?
Correct.
So why, I'm just thinking of like other health issues behind, like, for example, so my son has PSCP. They wanted to do the Botox injection.
Uh-huh.
And I was like, no, after I've read about it, no. I would rather have surgery.
So the Botox is, comes from botulism, right? The disease called botulism. There's a bacteria in it, and it secretes this toxin called botulinum toxin. What we've been studying, neuroscience has been studying botulinum toxin since, the 40s or 50s or something. It's been isolated as a known neurotoxin used in experiments for many decades. And because it's so well studied, people were able to get the gene for it, produce the protein for it outside, so there's no bacteria. It's the isolated protein, and study it in experiments. And we have this really amazing volume of knowledge about botulinum toxin. There's actually a few different types of botulinum toxins.
But even consider like penicillin is the product of another type of organism that you wouldn't actually want to eat, mold.
Right, now here's the additional, so we know how it works. The way it works, and it causes botulism, is that it gets into your nerves and prevents the nerves from secreting chemicals that are needed for muscle movement. So botulism, what occurs in botulism is you get paralyzed, and then you can't breathe, and that's how you die. But we can save you now from it, but that's how it runs its course. That's how it runs its course. It paralyzes you. But it doesn't paralyze the muscle. It prevents the nerves from telling your body to move, and that's how it causes paralysis. And we know how it does that. We know all the details down to molecular level.